Welcome back to Design and Thrive. This is another episode where we have Alec from Augment Health here with us today. Hello, Alec.
Hey man, how's it going? Thanks for having me on.
Awesome, awesome. How are you?
Pretty good. Coming back from a busy week, but excited to be here and excited to talk to you.
Awesome. So let's get to it. Can you share the story behind Augment Health and what inspired its inception?
Yeah, so we're originally a team of four founders, Sasha, Alexandra, Tom, and I. And it all started during COVID when Sasha was working on a environmental psychology. We're both architecture, our background is in architecture and design. And his particular interest was how is the built environment used to influence for the better people who suffered from environmental disaster. His background is in the Caribbean, so he went through a fair few hurricanes here and there, and using spatial design for good. In the meantime, he found out that coincidentally, Alexandra, who's his childhood friend from the Caribbean, they know each other since they were born, was working at that time on VR-based schizophrenia treatments, specifically for resocializing schizophrenia patients into the community, teaching them basic skills. And she was getting extremely frustrated by how just slow moving the process of innovation is, from creating a lot of amazing research proving the viability of a technology in a teaching hospital scenario, but then commercializing this is just, there's such a massive chasm. And that frustration got them to talk more about how VR can be used specifically for this. And my entry into Augment was from the perspective of the product development. I'm a tinker, fabricator at heart, and I have a deep passion for technology and how it can be used for good. So for me, it was the VR as a way to imagine, to use a term by Jeremy Belson, experience on demand, to apply it for good. There is this exciting possibility here, which hasn't existed ever in the history of our species, where you no longer can only just share knowledge. Hey, here's a book, read it. Hey, here's a podcast, listen to it. But you can also start sharing experience, and with experience is wisdom. And I think that's something that was exciting for me, and especially in the context of what they were talking about, coming in and putting it together to help with accessibility to mental health care. And so that's how Augment came to be.
Very good, very good. So what drew you to focus on behavioral health within oncology and pain management?
So we started with mental health care, just purely. We went through our fair share of, okay, let's make this a direct to consumer tool first. Then we found out that marketing to direct to consumer is a potentially risky thing. People don't really trust, especially when dealing with mental health. People don't really trust a Instagram marketing ad for, hey, let me be your therapist for you. What they do trust is they trust their clinicians to prescribe a tool, to prescribe a treatment that will actually meaningfully improve their treatment process. And so that's how we pivoted away from direct to consumer to kind of B2B in clinic move. But what we then found was that broadly selling to mental health care is, there's so much variability. It depends on the clinic, it depends on the geographical location, it depends on the patients being served. And so what it caused is a lot of feeling like you have to capture a lot of variables to be able to make it work. And as a startup, you have to be really serious about driving down into a niche. What's your beachhead market? And so for us, that beachhead market turned out to be chronic pain and oncology, where, if you think about like a typical user experience, you're diagnosed with cancer, to quote Tom, one of our co-founders, your head goes down the toilet, and suddenly you're dealing with chemo, you're dealing with surgery, and your mental state really influences how your physical treatment outcomes also are. What's your survivability of that cancer? And so we found that in chronic pain and in oncology, there is a particularly high demand for behavioral health support, but also a particularly limited supply of mental health professionals that specialize in that. And so that was the motivation to help there first.
So Alec, how did your team come together and what unique strengths does each member bring?
So this is a great question. So Alexandra brings the clinical rigor. She's a double PhD in experimental and clinical psychology. So, we are a research first company. We're a technology company, but what we want to do is we want to bring about evidence-based change to mental health care. And so her expertise navigating studies, the IRB process, but also making something that's a clinically valid, empathetic, evidence-based tool is really important. Sasha, who is our CEO, is a just I've never seen a individual who's got such phenomenal people skills, and something that I have appreciated since I started working on Augment is just how important people are, and talking to them, and being like genuinely curious about what they're up to, what's their worldview, etc. And Sasha exemplifies this unbound curiosity about the other individual. And what that means is his mind is extremely open to all the different possibilities. He's a deep optimist at heart, and he sees everywhere he looks an opportunity. Comes at it from a perspective of care and empathy, which I think is a very nice combination. And then Tom, who is a rock for us. He's definitely on the more mature side of our founding team. He is a restructuring lawyer, and specifically, he's been involved in a lot of, like, Kaiser Permanente, for example. He was there when Kaiser needed help, and he helped Kaiser become the thing that it is today. And he saw firsthand just how crazy in demand mental health care support is. And he's been acting as our general counsel, and it's just been a phenomenal journey. And for me, I provide the operations, the product development, the technology side. My claim to fame is if there is something that needs to work, I'll make it work. And I'll figure out how to put together processes and workflows and make people collaborate on something cross-functionally as well. And yeah, build something that can stand the chaos of the real world, basically.
And for listeners unfamiliar with Augment, how would you describe your core offering?
So what we provide first and foremost is an ability for clinicians in these specialty clinics to have more time to tend to tasks that are just high impact. And typically what that means is spending more time with patients as opposed to having to do admin tasks or fill out notes, etc. Things that don't really move the needle as much are obviously really important because, once again, it's evidence. There is a rhythm to how healthcare works. And so what we afford our customers is extra time. And importantly as well, our model supports the clinic and the clinicians and the care team in general. But there's also obviously a very big part of that, which is the patients, which is, they're the benefactors of feeling like somebody is listening to them, somebody's tending to their needs, and also tending to their needs in a timely manner, plus giving them a meaningful ways to maintain their condition and their spirit when their days are in their probably darkest moments, through exercises, through psychoeducation, through stress reduction.
Okay. So what sets Augment apart from other digital behavioral health solutions?
So we are deeply integrated into the clinical workflows. That's what we find as the most important part is, everybody's quite focused on the shiny opportunity that technology affords. And, don't get me wrong, it's like extremely exciting. But the thing about healthcare is that it is so constrained in how overburdened the people, active stakeholders within the care team are. You can think that they'll be excited to use something that on paper saves them time. But if it's something that doesn't fit into their daily rhythm of how their day goes, they'll just simply not use it. They'll get frustrated and they'll throw it out. And so to make something that is both value generating for them, the providers, the patients, but also easy to use and becomes an integral part of the workflow, I think is a simple at face value and a lot more challenging to implement correctly. And I think that's why you see a lot of these kind of companies going into a direct-to-consumer route, where you have to navigate a lot less stakeholders and seemingly the access is easier. With hardship, there are some upsides to defensibility, and I think that's something that's also obviously a strategic decision for us.
Okay. So you mentioned saving time for clinicians. Can you elaborate on how your platform assists clinicians in saving time and increasing patient coverage?
Yeah. So maybe the best example would be, think about a patient coming into a clinic. Maybe let me take a step back first. What we offer is conversational assessments and we offer those exercises, these immersive exercises for patients. So this first part, the conversational assessments, is, in its simplest form, a method of gathering information, gathering insights about patients that can then help the clinicians triage, who's high risk, who needs to be seen at high priority, what should be their treatment plan, and also get a sense of how they're doing from an ecological perspective. This is not only something that happens once at the beginning, but these conversational assessments and assessments in general happen all the way throughout the care process. And so, going back to the example of a typical user journey, a patient comes in, and what would normally have had to happen is you have to take the clinician or another member of the care team to physically sit down with the patient and just take them through the standardized assessment. How are you feeling today? Well, how have you been sleeping? Rate the severity of your pain. What's the location of your pain, etc. And this is something that can be performed in a self-guided manner and in a much more engaging and meaningful manner inside VR, where that healthcare professional that otherwise would have been spending the time with the patient, filling out paperwork, is now unloaded to have a maybe more meaningful interaction with other patients, increasing the throughput for the clinic, basically extending the reach that the clinic can offer to their patient population. And at the same time, provide billing support, make sure that those sessions can also be reimbursed, which is also very important for patients in terms of accessibility. So that people who aren't typically able to cover out-of-pocket expenses for therapy can actually access mental health care as well.
Awesome. So what feedback have you received from the early adopters of your technology?
So right now we find ourselves in a pilot phase. So we have 3 pilots lined up, and so far we've done a whole bunch of primary market research and also a lot of user testing. And once again, the main division here is that we have the clinicians who are just, every single time we go out to conferences or see them and demo them, they're just simply say, like, this is something that I need right now. But as it is with evidence-based industries, you also have to validate that what you're saying your product does actually, it does in real life. And this is why we're going into these pilots right now. On the patient side, we've been running users through it who voluntarily have been coming in for our internal user testing, and it's been honestly incredible to see what an impact a single 15-minute session using Augment does to these users. They come out saying that, thanking us, that they were given an opportunity to talk about something that's important to them. They already feel like their day has started off in a better way because they were given the space to feel like somebody listens, and the fact that they've been placed in a situation where they feel like for the first time in a long time somebody actually takes the time to care about what they have to say, to really hear and see them. It's a very interesting thing considering now we are more connected than ever, but that connection doesn't seem to be particularly high quality. And to immerse yourself, to embody an environment that's calming, and to be able to talk about the things that really matter to you, have a really serious impact on people's well-being and quality of life.
Okay. So about the early adoption with your pilot test, what strategies have you employed to encourage adoption amongst healthcare providers?
It's a lot of relationship building, it's a lot of trust. It's a lot of talking about their needs. It's a lot of demystifying what the technology is doing, what's happening under the hood, how data is being handled, how data is being secured. And so I think just working closely with these clinical partners has been the biggest reason why we find there is such interest. Meeting them at their needs, understanding their needs, and really trying to make something for them as opposed to pushing something that aims to replace them.
And how does artificial intelligence enhance the functionality of your VR software?
Yeah, I think what's the unique affordance of AI in the context of what we're doing, at least in our at our MVP stage, because we can talk about what may come of it in the future years. But it's the idea that it's a personalized care. It's always accessible. It's patient. It's non-judgmental. It's empathetic, and for lack of a better description, it cares for you. And so I think, and especially when combining AI with VR, you really diminish the layers of abstraction that are created with other ways of interfacing with that technology. Once again, the immersive quality of VR is really powerful when it comes to being present, feeling comfortable, feeling secure, and being able to disclose and share. And at the end of the day, with all these standardized assessments, the idea is that you just want to understand what's happening with the individual, and the more context you have, obviously allows you to have a much more nuanced approach to their care.
Okay. Are there plans to expand Augment services to other areas of healthcare beyond oncology and pain management?
For sure. That's where we're beginning, but there is a lot of potential markets. I mean, mental health care generally, hospice, end of life care, pediatrics, although there's, is a something that needs to be approached with a lot more care, and a lot more diligence, EAP programs and the like, high stress work environments. I think there is a lot of applications to what we're building. Yeah.
So what milestones are you aiming for in the next year?
Pilots are the most short term. I think if we're talking about the next 12 months, it's validating that our early stage product is doing, in fact, what we say it does. I think we're very confident that it does, and that it will show that, given some preliminary results that we've been having. And then at that point, it's just being able to service the customers that have indicated how interested they are in using this technology once validated. There is converting those pilots into sales from a business perspective is really important, and continuing to build out the core features of the product, hearing feedback from users and implementing that. I think user experience generally is something that will be a big target for us, and being able to continue producing research and publications to support what we're doing.
And lastly, here's your plug. How can interested clinics or practitioners get involved with Augment?
I think the best way to do that right now is to join our wait list. I think there's a lot of interest, and I just encourage people to visit our website at augment.health, and get in touch. I think what's we are focused on producing top tier research. If you're interested in collaborating on publications, that's something that's very much front of mind for us. And if you are interested in contributing and co-developing, I think we, fundamentally want to make sure that we're building something that is respecting the needs and meeting the needs of the people we're trying to serve. And I'd be lying if I said that we have all the answers, but I do think that one thing that I learned through this journey is that every single institution is just built up of people and collaboration and connections, and listening to others and meeting their needs is the key to making something really high impact.
Awesome. So that brings a close to another episode with Design to Thrive. We had an excellent time with Alec. Thank you, Alec, for your time.
Thank you. That was great.